Hi everyone, welcome to PharmaGrid. So let's continue with the remaining question discussion series. Question number 31. A compound that slows the metabolism of a xenobiotic is called as. The options are inducer, epimer, reductase, inhibitor, object. Here the correct answer is option D, that is inhibitor. An inhibitor, also called the precipitant drug, is a substance that blocks the metabolism of another drug called the object drug. An inducer is a compound that increases the expression of drug metabolizing enzymes. Both inhibitors and inducers alter drug metabolism that may cause toxicity or lack of efficacy depending on the metabolic consequence of the object drug. Next question. Which family of drug metabolizing enzymes is characterized as a microsomal enzyme that contains a porphyrin prosthetic group? The options are glucuronosyl transferases, cytochrome P450, flavin containing monooxygenases, esterases, N-acetyl transferases. So here the correct answer is option B, that is cytochrome P450. The family of cytochrome P450 enzymes are microsomal proteins that contain a porphyrin prosthetic group. Glucuronosyl transferases and flavin containing monooxygenases are both microsomal enzymes, but they do not contain the porphyrin group. Question number 33. Which polymorphic enzyme is responsible for the conversion of codeine to morphine? The options are TPMT, N-acetyl transferase, CYP2D6, CYP2C9, CCR5 co-receptor. So here the correct answer is option C, that is CYP2D6. The CYP2D6 is a highly polymorphic drug metabolizing enzyme that is responsible for the conversion of codeine to morphine. Both this codeine and morphine are opioid drugs. TPMT, N-acetyl transferase and CYP2C9 are polymorphic drug metabolizing enzymes but are not responsible for the conversion of codeine to morphine. The CCR5 co-receptor is not a drug metabolizing enzyme but it is involved in the cellular penetration of HIV. The term biological availability or bioavailability refers to the relative amount of drug that reaches the options are small intestine, stomach, systemic circulation, liver, kidneys. Here the correct answer is option C, that is systemic circulation. That is bioavailability refers to the relative amount of drug that reaches the systemic circulation. The relative bioavailability of a drug product can be determined by comparing which of the following values to similar control drug values. The options are area under the curve, total drug urinary excretion, peak blood drug concentrations. So here the correct answer is option C, that is 1 and 2 only. 1 and 2 means area under the curve and a total drug urinary excretion. The relative bioavailability is calculated by dividing either the AUC of the drug or the total amount of the drug excreted in the urine by respective values for the reference standard. The absolute bioavailability can be calculated by comparing similar data for the drug product to an IV bolus dose. The rate of dissolution may be described by which one of the following equations or laws? The options are Fick's second law, Pick's first law, Noyes-Whitney equation, Poiseuille's law, Stokes law. So here the correct answer is option C, that is Noyes-Whitney equation. The Noyes-Whitney equation is a modified form of Fick's first law used to describe diffusion. Next question. The peak of the serum concentration versus time curve approximates the options are point in time when the maximum pharmacologic effect occurs, point in time when absorption and elimination of the drug have equalized. Next option is maximum concentration of free drug in the urine. Then time required for essentially all of the drug to be absorbed from the GI tract. Then the last option is point in time when the drug begins to be metabolized. Okay, so in the question they have asked us about the peak of the serum concentration versus time curve approximates the. So the correct answer is option B, that is it is the point in time when the absorption and elimination of the drug have equalized. Prior to the peak time, the rate of absorption is greater than the rate of elimination and the curve ascends. After the peak, the rate of elimination is greater than the rate of absorption and the curve descends. Descends means decreases. If these rates are equal for some time interval, the curve will show a plateau rather than a distinct peak. Okay, so at this point or at this peak, the absorption and elimination of the drug will be equalized. Question number 38. For two drug products to be considered pharmaceutical equivalents, the products must, the options are have the same active drug or therapeutic moiety, should consist the same salt, contain the same excipients. So here the correct answer is option C, that is 1 and 2 only. 1 and 2 only means should have the same active drug or therapeutic moiety and consist of the same salt. So the pharmaceutical equivalents are considered to be drug products that are almost identical in all aspects and are expected to exhibit almost identical therapeutic activity. One of the few variables allowed is the choice of excipients. That is, excipients choice can be different. According to pH partition theory, a weakly acidic drug will most likely be absorbed from the stomach because the options are: the drug will exist primarily in the unionized, more lipid soluble form; the drug will exist primarily in the ionized, more water soluble form; weak acids are more soluble in acid media; the ionic form of the drug facilitates dissolution; then weak acids will further depress pH. So here the correct answer is option A, that is the drug will exist primarily in the unionized, more lipid soluble form. The ionic equilibrium that is established in the acid contents of the stomach will favor a relatively higher concentration of unionized drug in the solution. The unionized molecule, because of the absence of a charge, is more lipid soluble than the ionic species and will be able to cross the biologic membranes more easily. Question number 40. Which of the following routes of administration are least likely? Okay, least likely to be influenced by the first pass effect. The options are oral, inhalation, transdermal. So here the correct answer is option D. Option D means 2 and 3 only. That is inhalational and transdermal routes. Routes of administration that avoid the first pass effect include intravenous injections, inhalation and transdermal. By these routes, the drug is distributed within the body before metabolism by the liver. Okay, so with this question, we have finished today's question discussion series. Thank you everyone. Thank you for your cooperation. Have a good day.